So after 2 years of trying to flatten the curve, it seems that one public health official and president of El Salvador, Nayib Bukele, has finally woken up to the fact that, you know what, we need to address the elephant in the room. We ought to also have a public health campaign to help individuals manage their underlying health conditions, namely the obesity, the uncontrolled diabetes, the uncontrolled blood pressure, and all of the other chronic inflammatory and age-associated diseases that increase the risk that you'll catch COVID, get severely ill from COVID, land up in the hospital, and possibly even die. Now, it seems that both individuals, that if you ascribe to, say, the pro-vaccination camp or the healthy living campaign, or you're sort of in between, everyone should galvanize and get behind this message, because as it turns out, exercise, smoking cessation, stress and sleep management, all of the things that are featured in Nayib Bukele's video. Again, he's the president of El Salvador. He put out this campaign and launched it to address the underlying health conditions. We should all galvanize behind this, because if you're pro-vaccine and think we're going to vaccinate our way out of this issue, well, you should be pro-public health and you should be pro-exercise. You should be pro-healthy living, because if you have obesity, particularly abdominal obesity, high blood pressure, if you smoke, if you have hypertension, high blood pressure, if you don't exercise, you're unlikely to get sufficient protection from immunizations. Now, this is not a conspiracy theory. I'm not insinuating or perpetuating vaccine hesitancy. This is actual data from Italy and data from here in the USA that have shown that individuals with belly fat, blood pressure, smokers, people that don't exercise, don't have the optimal protection from immunization. So I think we should really, this could be a sort of cohesive and unifying message. That is, we should get out and exercise. Again, Nayib's video, I'm not going to play it. You can check it out on Twitter. I encourage you to share this video that you're watching, and also I will put links to the tweet. But again, El Salvador, of all places, right? Why aren't developed countries like Australia that are locking people in their homes, saying that people can't go exercise and saying that work is an insufficient excuse for the unvaccinated to leave their home, right? I don't know if you all have seen this data, but these are the daily cases per population. Miami has very few restrictions and mandates. New York City, you can barely go walking in New York City without a vaccine passport. Can someone show me the correlation between a reduction in cases and how that correlates with the percentage of the population that's immunized? We know that Puerto Rico, highly immunized, amongst the most immunized in the U.S., and it turns out that Puerto Rico ranks 5th in terms of daily new cases per capita. And if we look here, we've been following the science for over 2 years. We've been trying to flatten the curve. Well, I don't know about your eyes, but it looks as though the curve is shooting straight into the stratosphere. We are now recognizing over 1 million cases of COVID-19 in the U.S. now, okay? So this has been 2 years of ignoring health. This has been 2 years of closing gyms, closing parks, restricting movement, encouraging people to order fast food from their Uber Eats and mobile devices. Okay, we've been isolating, we've been distancing, we've been hand washing, sanitizing, we've been doing all these things that have completely ignored the underlying health conditions. And the president of El Salvador is one of the first public health officials, leaders, to say, you know what, we should have a national campaign to encourage people to get outside and exercise, to encourage people to manage their stress, to get more sleep, to do yoga, meditation, to eat more real food. Now, some people, the naysayers, will say, well, this message sort of proliferates this vaccine hesitancy and all this. No, it doesn't. It encourages people who embrace these healthy living concepts will likely get more benefit from the immunizations that they're getting. I mean, I think that's part of the failure of this campaign in terms of widespread immunizations that have been, there's been no recommendations for, in the weeks leading up to the vaccine, you should walk after your meals, you should get a good night's sleep, maybe cut back on your smoking, to just assume that everyone's going to get this supraphysiologic protective immunologic response because they're getting some exogenous antigen. It's contingent upon the health of your immune system. And we're now starting to see that. I mean, I'm not insinuating that these things aren't working, but clearly we have a much greater percentage of the population that's immunized, and cases are going through the roof. So it seems as though we ought to start to address additional factors. Now, we've shared this data with you. This was in July of this summer. July 2021. And we looked and this is the CDC's own data. If you're listening to this in iTunes or over in Spotify, you may not know this. The title of this paper is Underlying Medical Conditions and Severe Illness Among 540,667 Adults Hospitalized with COVID-19 between March of 2020 and March of 2021. What the data showed quite clearly is 94.9% of all individuals hospitalized had one or more underlying health condition that is largely attributed to or linked to poor dietary and exercise choices, okay? What they also showed is that obesity was the number one leading risk factor for death, followed behind anxiety and conditions of fear. So what are we doing? We're scaring people. We're showing pictures of people dying in the hospital, hospitals being overfilled that is driving fear, irrational behavior, okay? So it's time that we shift the focus. It's time that we change the narrative and do what El Salvador is doing and promote actual healthy living. It will make the vaccines more effective. It will make people more productive, contributing members of society. They'll want to go to work, make more money, be healthier. They'll want to invest in their health. And there's actually really good data to support this, because this study right here, and we shared this again, this was March of 2021, my friends, March of 2021, March 8th to be exact, when we shared this video. This was in the Journal of the American Heart Association. Okay, not a fringe journal. The title of the paper here is Coronavirus Disease 2019 Hospitalizations Attributable to Cardiometabolic Conditions in the United States, a comparative risk assessment analysis. So as we talked about, as we broke down this paper in greater depth, I will link that below, link it in the show notes so you have access to this. About 575,000 of 4.8 million hospital visits and hospitalizations could have been prevented by focusing on exactly what the president of El Salvador is trying to do for his constituents, and that is exercise, stress management, sleep, eating real food, getting out in nature. Okay, these are all things that we should be focusing on. Okay, now two things can be true at once. You can promote vaccinations to the elderly and the vulnerable, and you can promote healthy living at the same time. These are not mutually exclusive concepts. It just seems that the public health officials or the government, they don't know about the science, or they choose to ignore it, or they don't think it's very effective. But again, this is the American Journal of the Heart Association. Our own CDC has found this, okay? Underlying health conditions are prevalent in 94.9% of people who got really sick with COVID, and the number one risk factor for death was obesity. What's going on in developed countries? We're closing gyms. In the province of Ontario in Canada, gyms are now considered dangerous. It's 2 years later. I mean, what are we doing? We know that gyms were not a significant vector of disease. What's happening in Australia? We have professional tennis players being banned from entering the country for a tennis match. I'm sure they're going to be tested, but because they're unvaccinated, they can't come into the country. Are you kidding me? You have an athlete who's an elite athlete, probably takes his health very seriously. The probability of him getting severely ill is slim to none. But you're going to make a statement by banning this individual from coming to your country. These things are going on all over the place, my friends. And I think it's time now that we shift our tune and we start to talk about the tangible ways that we can become more resilient, that we can become a less hospitable host for pathogens, for microbes, because whether you want to accept the reality or not, this particular pathogen, that is SARS-CoV-2, it's not going to be eradicated like everyone thought, like what's happened with polio or smallpox or any of these other viruses that have been essentially eradicated through widespread vaccination. Even Dr. Anthony Fauci himself and other experts and a lot of scientists who specialize in vaccinology and immunobiology and all this, they say that was an idea. It was a hopeful presumption, but it's unrealistic. So where does that leave us? Do we mask in our homes and isolate till the end of time? That's not a viable, sustainable solution. What is sustainable? Focusing on exercise, eating better foods. We can agree to disagree about vegan diets versus carnivore diets versus keto diets, but I think unanimously across the board, most individuals who study nutrition and health will say, eat real food. It doesn't matter. If you want to be a plant-based vegan, that's fine, whatever. Just don't eat packaged, processed vegan junk food, okay? If you want to be carnivore, that's fine. Try to have more, less bacon and pork rinds and more lean, healthier, cuts of meat and so forth from local farmers and pasture raised, as long as the animals were treated well and ate as close to a natural environment, lived in an environment and ate a diet that was closely mimicked or matched historically what they would eat and how they would live, it's probably sufficient, okay? We're splitting. We don't need to split hairs on nutrition, but the sleep, the stress management, the relationships, all of those things should be a priority. So please make this video go viral. Again, this is from Nayib Bukele, I think. And the title here is our new ad campaign to help prevent COVID-19 deaths and hospitalizations in El Salvador. So I think this is amazing. I think we should make healthy living great again. My friends, please spread this message. Thank you for tuning into this podcast, this video. Let's encourage our friends and family, wherever they fit on the masking, social distancing, vaccination mandate spectrum, that all of that stuff would actually work better if they also include some of the tenets that are featured in this video. So let's do it, friends. I know you can. I know you can encourage the people in your life to take those steps, to take those measures, to walk more, to sleep better, to get the TV out of the bedroom, to exercise outdoors, to breathe fresh air. We can do this together, friends. So as always, thanks for tuning in. We will catch you on a future podcast down the road. What do you think about this? Let me know in the comments. Bye now.